Hi, everybody. Welcome to the 2023 National Postdoctoral Association's International Equity Summit, panel number 2. We'll just wait for a couple of minutes as the attendees join, and we'll begin shortly. Good afternoon and welcome everyone to session number 2 of the NPA's International Equity Summit. I am Tanya Paes, one of the international officers at the NPA, and I'm just delighted to be co-chairing the summit along with Tom Kimbis, and I will be serving as moderator for today's session. This session aims to shed light about the different health challenges faced by postdocs, including navigating the U.S. healthcare system and addressing behavioral health issues. Our 3 amazing panelists will share experiences about how postdocs can advocate for themselves using approaches such as mentoring up, and will also provide examples of how the diverse needs for health and wellness services for postdocs can be translated into practical services and programs. If you have specific questions for the presenters, please be sure to enter them in the Q&A. We may be able to address some of these questions during the course of the presentations, and we'll reserve time at the end to address remaining questions. During equity summits, we sometimes touch on sensitive topics. If any of you feel you need assistance, please do not hesitate to reach out to your postdoc office or appropriate office at your institution. These offices are there for your help, and you should take advantage of them. As a reminder, this session is being recorded and will be available soon on the NPA website. So now, without further ado, it is my pleasure to introduce our 3 speakers for today's session. To begin, Amy Ramirez is Executive Director, Global Learning and International Services at the University of Maryland, Baltimore. Amy has over 20 years of experience in the field of international education. Her current role at UMB includes leadership of the Office of International Services, developing new global learning opportunities for UMB students, and overseeing a faculty development program focused on globalizing the curriculum in UMB's degree programs. Before coming to UMB, Amy worked in international student and scholar services at Johns Hopkins University and the George Washington University. Amy has served in several volunteer leadership positions in NAFSA, Association of Educators, most recently as a trainer for NAFSA's Management Development Program. Amy holds a bachelor's degree in Spanish Learning and Literature from the University of Maryland, College Park, a master's degree in International Education from the George Washington University, and is a Ph.D. candidate in Higher Education Administration at the University of Maryland, College Park. Joining us today also as a presenter, we have Dr. Mudita Upadhyaya, who leads St. Jude Children's Research Hospital's Employee Wellness Program, orchestrating an innovative well-being initiative for a diverse workforce, with prior experience as postdoc fellow and as a senior wellness manager in a large academic center in Texas. Mudita excels as a corporate well-being expert, boasting a strategic health and HR background. She holds a doctorate in public health from the University of Texas Health Science Center and a master's in public health from Tulane University. Her research focuses on worksite-based nutrition and physical activity interventions to combat obesity, with over 20 co-authored publications in esteemed journals. And last but certainly not least, we have passionate in mentoring, teaching, and research, Dr. Danielle Little is a postdoctoral research fellow investigating retinal degradation at St. Jude Children's Research Hospital. Her doctoral research culminated in first author publication in Nature Communications and PNAS characterizing lineage transcription factor function in lung epithelial cell fate decision. While her Ph.D. research focused on genetics and epigenetics in development, her postdoctoral research dives into aging, disease etiologies using a broad range of molecular and in vivo approaches. Her health has always been at play in her career as her chronic condition, hypermobile Ehlers-Danlos syndrome, leads to a plethora of shadow illnesses that limit her physical and sometimes mental capacity daily. Capitalizing on her available strengths, she often weaves in and out of wet and dry research, answering questions strategically. She has also driven career development series, run an amazing editing team, served as teaching assistant, and designed courses for graduate students and postdoctoral fellows. Thank all three of you for being here today. We will begin today's panel with Amy Ramirez, and let's get started.
Thank you so much. Let me share my screen here. Pull up my slides. Okay, so thank you. I'm really happy to be here today to give sort of a brief overview of some of the health and wellness issues that come up for international postdocs from my perch in the international office. When I was thinking about what I wanted to say in my 10 minutes, I wanted to speak about two issues that I find come up a lot, namely navigating the US healthcare system and mental health. After naming some of the issues, I want to summarize strategies for the international postdocs that are joining us on this session, but also speak to our colleagues in postdoctoral associations and postdoc offices about things that we can do within our institutions to improve the international postdoc experience. Okay, this may sound obvious, but I've often found that it's really important to say to international postdocs and my domestic colleagues that the US healthcare system is very different from health systems in other countries. International postdocs, especially those who have not gone to graduate school here in the US, are encountering this system for the first time. There may be a big difference in the cost of healthcare, right? It's very expensive here in the US, how healthcare is paid for, and how to access it. Onboarding programs for new hires may not be as explicit on these issues as international postdocs need. So to use an example from my own campus, onboarding is run by Central Human Resources, and it's for postdocs as well as faculty and staff. So I think it's really crucial for international postdocs to get clear explanations of health insurance terminology and our system. So for example, we may have postdocs that need to have the difference between a premium, a copay, and a deductible explained in jargon-free terms. I also think it's really important that we educate postdocs about reviewing plans, right, and thinking about their own health needs, right, particularly for those with chronic conditions. For example, my campus has 5 different medical insurance plans for employees, and choosing among those is something that postdocs really need to consider when they're trying to manage their health and well-being, right? How much you pay monthly is one factor in a constellation of issues that needs to be considered. And then so we encourage our postdocs to really review our health benefits information and compare different levels of coverage. Finally, the variety of healthcare providers in the US can really be overwhelming sometimes to international postdocs who come from countries that may have a more streamlined healthcare system. So there are short videos out there that we like to refer our international postdocs to that explain the role of urgent care, private doctors' offices, and hospitals within the US healthcare system, and when each should be used. So we explain these issues a lot to international postdocs in the international offices where we work. And I think one of the things I really want you guys to be considering is how do we make sure that this gets very thoroughly incorporated into the way that we prepare new postdocs coming onto our campus. Okay, In addition to physical health, mental health is really a very important issue with the international postdoc community. And some of the issues that I am naming here on this slide are common to all postdocs, but there's often a special flavor to them with the international postdoc community. Something I think that has to be named as an issue is the stress of contingency, meaning the very temporary nature of postdoc employment. All postdocs are really living with the reality of being contingent academic labor, but one special factor that I think has to be kept in mind with international postdocs is that most of them are on university-sponsored visas, so they have an extra layer of uncertainty. Losing your job is a very difficult thing for anyone to experience, but losing your ability to stay legally in the US if you lose your job just raises the stakes for international postdocs. The pandemic further complicated an already difficult situation for international postdocs in terms of building social networks in their departments, institution, or discipline, and adjusting to life in a new country. I also know from experience that the rise in anti-Asian sentiment in the US during the pandemic hurt many international postdocs. Work-life balance is a real issue for all academic workers today, but I do want to note that a lack of social connection and community outside the laboratory, or even sadly within it, can make this problem even worse. Finally, I've really found that postdocs may come from parts of the world where seeking mental health treatment is stigmatized, or may not have had access to mental health care at home due to a lack of providers. In short, international postdocs in many cases are really starting over in a new country, and all these factors can just lead to poor mental health. Okay, so I've spent a lot of time sort of naming challenges, but I want to end with discussing concrete strategies to advance international postdoc health and wellness. For postdocs, I think one of the most important things in my view is to see health and wellness as integral to your professional advancement and identify health and wellness goals for yourself. Our best intellectual work isn't possible without health, and attending to health and well-being is important to advance all of our professional and personal goals. It is important to learn about and use resources beyond the lab or department. Many health and wellness resources exist at the central level in many organizations, and sometimes you have to seek out the opportunities, right? So read newsletters, browse the website, and get information. Social wellness is crucial to overall happiness, so I encourage everyone to just get involved in something, right? Go to a lecture, join your postdoc association, take up a hobby. Finally, if you're having a hard time navigating the US healthcare system or just need some help, talk to someone. Tanya just mentioned the postdoctoral office, but I'm here to remind you that the international office also exists to serve you. I know we're best known for our immigration expertise, but we do a lot more than that. Okay. And I also want to talk to representatives from postdoc associations and postdoc offices. A lot of the issues I identified earlier in the presentation are structural in nature, and in my view, structural problems can't be solved by individual responses alone. First, I think it's important to learn more about the work each of us does and find ways to collaborate, set up regularly scheduled meetings just to learn what's going on in each unit, or collaborate on events. It's really helpful. As a small example, my office regularly shares data about incoming international postdocs with the postdoc office because we know who's coming before they even get here because we do their visas. I recommend having some conversations also about onboarding, particularly thinking about how to ensure that the education about the US healthcare system and wellness resources in the institution is occurring. Finally, I think it's really important that the needs of the international postdocs are raised in conversations about employee wellness. Here's an example of what I mean. On my campus, for example, we had a childcare grant program for employees that are below a certain household income threshold. Postdocs are eligible for it. However, the way that they evaluate household income is by requiring applicants to submit their last year's US tax return. So international postdocs that are within their first calendar year in the US don't have one of those yet, right? So fortunately, I have a good working relationship with our colleagues in human resources, and they reached out to me to ask for some information because they know that we have information about our international postdocs. So the postdoc in question was able to receive a child care grant, and it was really important for her. So be the person in the room that's raising awareness about postdocs. They're often missed in conversations about our workforce, and they're the most international group in US higher education. So thank you so much for letting me share here. I'm going to turn it over to Mudita, who's going to speak next.
Thank you so much. That was a great overview of how you all are doing from the Postdoc Association and office perspective. What I'm going to present today is from the employer perspective. So good afternoon, everyone. My name is Mudita Upadhyaya, and I lead the Employee Health and Wellness Program at St. Jude Children's Research Hospital. So a little bit about our institution. So St. Jude is located in downtown Memphis in the state of Tennessee. We have a very diverse employee population representing many countries outside of US. Many of our scientists, researchers, postdocs arrive to work here from countries where healthcare service delivery is very different from that of USA. So Living Well is our employee wellness brand, and our hope is to offer a health and well-being program that encourages healthy behaviors among employees. I really want to highlight that we have population representing 65 plus countries. So we are a truly very diverse population. We are not a typical hospital. We are a research institution, and we have a reach across the globe. The mission of St. Jude Global Initiatives is to improve the survival rates of children with cancer and other catastrophic diseases worldwide, and especially in low and middle income countries. So St. Jude is committed to health equity by providing free care to children in need. So essentially, health equity is in our DNA. So how do we support our employees, including our postdoc community? So by definition, health equity is the state or the assurance of the conditions for optimal health for all. And health equity and employee wellness are closely related concepts that both aim to promote the well-being and health of individuals, but their focus on is a little bit different and on different population. So through St. Jude Wellness, our aim is to support our postdocs in their well-being journey and offer them opportunity to attain their health potential, regardless of their cultural background and socioeconomic status. As we all know, navigating the US healthcare system is not easy, and as a postdoc researcher, this can be even more challenging. The US healthcare system is complex. It involves multiple options for obtaining coverage. And post-COVID, we are all aware of the importance of disease prevention and timely intervention. So at St. Jude, the Living Well program typically offers 5 pillars or components that focus on various aspects of well-being, often aiming to help individuals improve their overall quality of life and health. We have a plethora of well-being offerings, including on-site and virtual options. Many of these are actually offered free for our employee and our postdoc, including our postdoc population. We have a dedicated nurse who works with our employees to manage their chronic conditions. We have a free EAP service, a very comprehensive EAP service, and we have on-site and other digital resources as well. So having an on-site clinic has worked wonders for us and for our employee, as this clinic serves as a wellness hub and is an excellent approach to promoting the health and well-being of our postdoc community as well. Our on-site clinic offers primary care, mental health, wellness coaching, behavioral health. We also have a fully equipped pharmacy, all under one roof. So when you are arriving at your work, you don't have to miss work. You don't have to step out of St. Jude campus to take care of your preventative or curative health. From the very beginning, we set out this concept of health and wellness hub, which is physically centrally located on campus. And our approach is a whole person health approach. And our navigators are available there to help with health and wellness systems, even outside in the community. Another thing is that the cornerstone of well-being for our employees is our highly competitive health plan. Our executive team truly believes that that low employee cost, high quality health insurance plans are essential. Each year, we review national market trends and our workforce demographics. We reach out to employees through various surveys through Yammer, which is equivalent to like an internal Twitter. And we implement various offerings that will support our employees and researchers the most. These are some of the awards that we have won in this year. And we regularly monitor Glassdoor comments to better understand what new employees, our researchers, our scientists, future employees feel about our well-being and benefit offerings. We also survey our employees about benefits and wellness preferences. We are about 65% female population and our average age is around 42. We are a heavy millennial and Gen X population, but we also have plenty of Gen Z and baby boomers. So we need a wide range of employee benefits that appeal to all generations in our workforce. So as you can see, we have a lot to offer. To navigate their life and live their life at the highest potential. I'm not going to go over each one of these details, but I want to highlight Rosalie, our 2-year-old golden retriever who's dedicated to supporting employees and our postdocs. She will attend sessions with staff after events such as, loss of a patient or colleague, or staff can request visits, or if somebody is stressed out, they have requested Rosalie to make rounds in their apartment, and she's a star of our campus. And I feel like sometimes we get so busy with our bench work, with our research, that we need a reminder that it's okay to take some time to breathe, laugh, or just even have a conversation. So at St. Jude, we are a family, and when it comes to balancing work, life, and family, it sometimes takes a village. And that is the approach that we have adopted. This is where our department comes in to help. We offer support for all stages of life, ranging from people who are starting a family to cost-effective childcare options to college saving programs, so that our employees can enjoy moments and can invest in their research if that means most to them. Trying to manage daily responsibilities and life events can be really challenging at times. So our wide-ranging mental and emotional health services helps our researchers manage their daily life, including one-on-one counseling, our on-site behavioral health counselor, information on parenting, adult care, health, wellness, stress, financial services, you name it, and we have it. This is a success word cloud based on 500 unique employee comments about our on-site clinic. These are some of the pictures of our on-site pharmacy and our Living Well Health and Wellness Center. These are our wellness rooms, which has more of a whole person approach. So even if you don't have any primary healthcare need, you may just want to come and have a chat, discuss your future health goals, or just connect with someone. Very recently, we've identified social isolation as one of the biggest epidemic that we're facing right now. So I think this helps connect our community, with whatever resources they would like to have. We have a full-fledged fitness center, not the kind that you have in hotels, but a much bigger and a fully functional fitness center. We also offer a lot of incentive programs to engage our community. So in summary, what is it? At St. Jude, health equity is in our DNA, and that offers some really unique opportunities from the employer side to address health equity among diversified population. And health and wellness challenges can be particularly pronounced for international postdocs due to the unique combination of, work-related stressors, cultural adjustments, visa restrictions. And at St. Jude, we say that we do not have shortage of employee benefit offerings. The struggle is for our postdocs to know what's available and where to locate it. So we are continually partnering with a lot of departments. We have revamped our new employee orientation program, postdoc orientation program, where we go and present and we do active outreach with this population. So here are some of the ideas if you're thinking how to, where to begin with. So I think one opportunity lies in optimizing wellness and benefits offerings. There is a great opportunity in expanding the access to primary and mental health care, prioritizing cultural adjustments and social connectedness and work-life balance. If you all have any ERGs at your organization, please do find out, connect with your officers and see, postdoc officers, and see if they can help you connect with the appropriate ERG, which is an employee resource group. And most importantly, we have to have a common language and easy route to these services. So making healthcare and benefits easy to navigate is equally important. And last but not the least, evaluate strategy. More often, what wellness programs do is that they launch the program before and not really think about the evaluation piece. So that's another thing that we found out, that sometimes the best solution lies with the consumers who are actually at the farther end of the pipeline. So it's best to reach out to them and ask how we can help, how can we support you, and solicit their feedback and integrate those conversations into your planning strategy. That's all from my side, and let me know if there are any questions. Thank you.
Thank you so much, Mudita. We'll now have Dr. Danielle Little, who will talk to us about her experiences as a postdoc.
Hello, thank you again for having me on this panel. As Tanya mentioned earlier, I have Ehlers-Danlos syndrome, hypomobility type. And so essentially what that means is on a daily basis, things are very different, and that can also be on a monthly basis. So as an example, from May to June, I lost 15 pounds unintentionally just due to being sick with no actual reason as to why I was sick. And so that drastically changed my functional ability on a day-to-day basis, whether I had to run to the restroom or not, right? And while I'm talking to you, as a person who grew up in the United States, I don't have as much of a diverse background. I can only imagine that the struggles are different when you're international, you're not used to communicating about these sorts of things in general, and you're bringing up a very personal subject with people you don't know. But really what I want to stress is what I've learned from my experiences and how that may help others, whether my applicability may be a little bit limited or translational to other aspects of either mental healthness, regular health wellness, and many other aspects, right? And overall, I would say transparency is key. Even from the beginning, if you're open and honest, that doesn't mean all problems are going to be solved. But I know of individuals who have started their postdoc without disclosing that they had a chronic illness, and they were then essentially told that they would need to be pushed out, and sort of ended up having to leave the lab in less than a month after having joined. So there are circumstances, while that is horrible, that do happen, and you don't want to really work with people who don't want to work with you. The other thing is, if they don't know how to work with you, then it's hard for them to adapt and help you. And so really, in addition to transparency, you really need to have kind of a meta-analysis about yourself. 1, what are my strengths? 2, what are my weaknesses? 3, how can I use these to an advantage in my current circumstances? And then communicate those, right? Because dealing with a problem and communicating to others that could help you deal with that problem is very different and take very different skills. Kind of as a broad idea for this, you can kind of think of this around mentoring up, right? If you know yourself better, you can help someone else help you become better, right? And so if you don't know what you need and you can't articulate what you need, then others can't necessarily help you. And in addition to that, you can't necessarily assume that the individuals you're working with will understand what you're going through just because you've told them you have X, Y, or Z condition, whether it be depression or whether it be some sort of tachycardia where stress makes your heart beat faster and you have anxiety. You know, there could be all sorts of different scenarios. And even if you use the words, the illness or things that you're dealing with may not be communicated very well. So being able to explain those, you're still going to get some weird questions, right? Some of the questions that I've gotten in the past are, in a day, how much time can you spend at the bench? In a week, what percentage of time can you do wet work, right? And those questions are very reductive. But if you don't actually have a basis for understanding where the person is, that's kind of how you have to think about things in order to support them. And so meeting your mentor halfway by trying to explain things or using additional tools. Like I had problems using a piece of equipment and I ended up tweaking my spine because my body is very loose and such. And I ended up having to show my PI how my spine had curved in result of using this piece of equipment in order to get the support that I needed. That sounds drastic, but sometimes what you say isn't necessarily what they see. This is especially the case with chronic illnesses and mental health issues where it's invisible, right? If you don't have an arm that's broken in a cast, how would you expect them to know what you're going through? Unless you show them and or talk to them and communicate. And so this is also interplayed with managing up, because if you mentor up into explaining your circumstances and explaining what you need, then they can also help manage you and help you become the best at what you are good at, right? So for me, I've leaned a lot more, as I mentioned before, or as Tanya mentioned, into doing both wet lab and dry lab and more strategic work that I can do on a long-term basis that doesn't require or won't be as impacted by the day-to-day struggles, right? If I'm sick one day, I'll go sit at the computer and type away, learn my bioinformatics skills. And while this is diversifying my talents, it's also maximizing my potential moving forward because I understand a lot of things. And I think that's very useful. The other thing is when you're mentoring up and managing up in these circumstances, you can do the setting of expectations, because if the PI doesn't understand what level of help you need or how much you can perform, or if they stress you out, will you get sick? Then you need to let them know where the boundaries need to be so that you can help your health, right? If you are stressed, which is going to be the case with a lot of international students or postdocs or students, in general, you are in a less known environment. You've lost your cultural connections, you've lost your family connections a lot of the time, and you're going to be more stressed. So any normal issues that you're dealing with will actually be magnified by that stress to some degree. And so if you're honest and open about what's going on, sometimes they can help with that. And definitely joining social groups will help, talking to people. Honestly, there are a lot more people out there that are going through different scenarios that have similar consequences. And if you learn to learn laterally from these scenarios, you can integrate it and kind of move forward in communicating with others. And not only are all of these approaches I've mentioned useful for you and the PI, but they're also useful laterally with your lab members or individuals in the postdoctoral association. Because these lateral connections are useful, in general, at least at the postdoctoral stage, it's becoming the point where you're an expert in your field, but everyone's an expert in a slightly different thing. So instead of having someone that's more knowledgeable of you than you need to start seeking out people that are laterally just as knowledgeable at you, but at something else, right? And so you really need to build that network around you so that you can have the resources to succeed. Now, one individual thing that has happened as an individual with a chronic illness, I went to my PI and I asked him how or if I should do this, right? Can I do this one? Should I do this, right? And those are two loaded questions. So knowing how you're communicating can influence their responses, right? If you think about the context of my own health issues, my PI had no option but to answer yes and yes, right? Because that could be a huge HR issue. And so you also need to take into account who you're talking to and what kind of stringencies they have on the way that they can communicate. I'm going to take the last minute here to really talk about some additional things that can be helpful. Is there are other resources that can be completely useful. As I mentioned here at as was mentioned by Mudita, we have this amazing health and wellness hub here at St. Jude. Rosalie is amazing and a much loved favorite of the postdocs. But in addition to that, in a lot of institutions, there are ergonomics departments and ombuds, right? So those are essentially mediators. So if you do have conflict, which hopefully you don't, and you never have to because of your transparency and your open communication, there are resources you can seek out to properly or possibly resolve these issues without ratcheting up the tension, right? The ergonomics has been a help for me because it helped with that system. We could then move around the tools so that it was less strain on my spine, right? And then we also brought in people to help. So there's many options across institutions, and really doing that deep dive meta-analysis of who you are, what your strengths and weaknesses are, as well as what context is coming into each conversation from those around you if you're talking about these issues. I think that really will help move forward multiple individuals, especially postdoc success, because you can work much better as a team if you're getting the help that you need. But yes, thank you so much again for having me here. I'd love to take any questions. Tanya?
Thank you so much to all of our three speakers, Amy, Mudita, and Danielle, for really sharing from their respective roles about how to support postdocs, and in Danielle's case, herself, in terms of advocating and making sure that health and wellness needs are met. We've got some great questions that are kind of coming up through the chat. I wanted to begin first by asking a question of a theme that came up through all three of your presentations, which was early interventions in this case is that both institutions as well as individuals can use to kind of address this issue head on. And so I'll pose this question to the three of you, and maybe we can answer it in order of how you guys presented. But basically, as part of the onboarding process that you mentioned, Amy, or during the orientation process that individuals go through at their organization, Mudita, and in the initial days of a new postdoc position, Danielle, what is one practical strategy that you could suggest that can be used to support postdocs, or if you're a postdoc yourself, in terms of health and wellness?
I definitely have a quick answer to this. Set boundaries, which is very hard to do. But knowing what is healthy for you now and what would be helpful for you later. If you go full steam ahead, you've established that you're willing to just go the distance no matter what. So if you set boundaries right from the beginning and you stick to those boundaries, you can reaffirm positive mannerisms or new ways to take care of yourself to prevent long-term changes and problems.
I think from my perspective, which is the benefits, wellness, and HR, I think one thing that we can do is ask questions. Do not hesitate, or do not hesitate to reach out, to explore, to connect. It's very different because in some cultures it's not considered okay to ask questions if you're very new to the group. It's also not considered, appropriate sometimes to reach out for preventative health, because that's not how they seek health in their side of the world. So you're really valued and esteemed at your organizations, and we are here to help you succeed in whatever plans you have, personal and professional. So yes, definitely that would be my one take.
I love those suggestions. I always elevate when I think about these things, I'm always elevating to the organizational frame, because I feel like there's these individual strategies that are, of course, really important. But as somebody that works in a service office, I'm always thinking about how we organize ourselves institutionally to meet people where they are. So, one of the things that we noticed during the pandemic is that we have, for example, J1 Scholar orientation that we started doing online during the pandemic. And one of the things we discovered is we had people joining us from outside the US before they even arrived. And so now we're in the process of developing a pre-arrival orientation for our international postdocs, right? And making use of the online space for that, to really sort of think concretely about, okay, how do we, there's often so much focus we find from the time you have a job offer until you're in the US is very focused on the visa process, which of course is really important. And then I think what winds up happening is they get here and they discover that there's a whole set of questions that they hadn't even thought about that's really important now to their ability to be productive and to be engaged in their work, right? Figuring out housing, figuring out childcare, like all of these various issues that are unique and specific to them. So I think that the more that we can get information into the hands of postdocs before they even get here, the better off we are.
I think all three of you shared things that were really salient that can hit a variety of postdocs at different institutions, and even if they have varying availability of resources, which is particularly important to consider. We had a question in the chat. So if any of the three of you could speak to this, if you've had some experience with it. It was in regards to, is there a tool or space in the individual development plan or the IDP to facilitate conversations about differences and abilities between postdocs and their supervisors? For example, a space to explain individual needs and personal, mental, physical health goals, for instance. Maybe we can start off with Danielle, if that's cool.
Yeah, I would say that in the IDP, I would say yes and no. So I can be honest, our PI that I currently have, we have check-ins for IDP every 6 months, but they're very loosely structured. And so we do set individual goals, and at least personally, I do bring up my health issues during the time, and that will usually influence my overall goal for the year. So this last year was particularly difficult, so I was focusing more on building up bioinformatics skills. I think The mental goals we usually tackle in a broader sense. Example, hey, look, I've been stretched very thin this year. I need to work on building my confidence. And like I mentioned during kind of what I was talking about, transparency is key in having those conversations. Of course, you don't necessarily feel comfortable right off the gate having that kind of, open conversations. So it's very essential to have a supervisor or choose a supervisor where you're very comfortable talking to them.
From the organizational perspective, what we have started doing, and this is a recent project that we have taken up, is to start training our supervisors, managers. So instead of bottom down, we are top down approach where we sensitize our faculty, our executives, our leaders, our people leaders, why creating a psychological safe space is so vital to success, not only to the organization, but to individuals as well. So I think from our perspective, what we've done is in addition to a lot of resources that are available, we are now started to train our people leaders into getting sensitized and supporting their teams and how best to support members who are stressed out or burnt out, and connect them to resources. And we really emphasize the diagnosis is not the key. You need to be understanding and facilitating them and connecting them to the much needed resources.
I think all of those aspects are really key, and again highlight the variability in different institutions as to how prevalent, for instance, the IDP is used in the organization, and also, like Danielle brought up, the issues of individual differences, such as like comfortability and being transparent with your PI, but also, for instance, what that relationship with the PI can also look like, and managing that individual relationship as well. So unfortunately, it's not a one-size-fit-all answer, but more catering it to your specific needs. We only have about a couple minutes left before we end the session. So kind of one last question that I think I would like to pose to all three of you, which again, all of you touched upon, was you each brought up, and sometimes in our respective groups as postdocs, the subgroups being domestic postdocs and then international postdocs, they each get painted with the same brush in terms of diversity, which is not necessarily the case. And so how do you go about in your roles or as an individual identifying the diverse needs and requirements of postdocs? Amy, we'll start with you because you're grinning from ear to ear.
Oh, isn't that the $1 million question? Honestly, like that's, I think, the challenge in almost every organizational space today. Like people are complex, right? It's not one size fits all. And I truly, honestly don't think that we can have one size fits all work-life balance or wellness. I don't believe in a normative understanding of those issues at all. So I think that the answer to that always has to start from, okay, we need good mentorship, mentoring relationships, and that needs to be rewarded and accounted for in the work of leaders, right? So that they actually know their people. And then from there, I just think that you have to have a way somehow to routinely check in with the postdoc community and regularly ask them what needs of yours are being fulfilled within this environment and what's missing. And that's going to vary widely from person to person. But I think through focus groups or through leadership at the laboratory or the department level or in postdoc offices, you begin to get a sense of, okay, where is there enough of a critical mass where this is coming up again and again and again, and we clearly need to identify some avenues to address this problem on behalf of a sizable community of our postdocs.
We host postdoc coffee hours. We also have organizational surveys where we encourage people, our community, our employees, including postdoc, to give candid feedback. Another way is also to directly reach out to whoever your connection is, or have an accountability partner where you can talk it through and link and reach out to people. HR sounds intimidating, but it's really not. For the most part, we are here to support, like I said before, your professional and personal journey. So I think those are some of the ways that we gather feedback.
I have to second Amy's response on this, that the mentorship is key, right? And as mentors, as individuals running labs, you need to first reflect on yourself, because in general, nobody should have just one mentor, right? So identifying what kind of needs the person has when they come into your lab is essential, right? And some of those first conversations should be really about getting to know each other, establishing rapport, and identifying where you may not be able to help them succeed. And so finding additional mentors for them would be ideal, because you need to have a network of mentors anyways. And if you can identify that in the first few months to help them get a supportive network in areas where you might have blind spots, that would be fantastic. And I think that would be extremely helpful for international postdocs, because if you're not from outside of the country, how would you know what external pressures you're facing? Or if you're not from a specific culture, you need to connect them with someone who can make the next steps, right? And if you can't connect them with someone, maybe they can give them tools to find this, right? New PI Slack, Postdoc Slack, there's other options out there. Help them find the tools so that they can identify mentors to help with this.
Thank all three of you so much for an incredibly stimulating session. That was a hard topic, but you were able to provide a lot of hope and practical strategies to take away. So I hope it was beneficial to our attendees as well. If you aren't a member of the NPA yet, please join. It's free if your institution is an NPA member. Please feel free to check out the NPA website and the chat to find out more. The Zoom link for the next panel is in the chat and on your calendar invite. You have to use the new Zoom link for the next session. Thank you all once again for your interest in promoting international equity in the postdoctoral community and beyond. And we'll see you in the next session, hopefully. Thank you so much.